Dr. Roshto. So we're at the end of the weekend. You're probably tired, right?
Burn out.
So kind of do us a favor and kind of give us a synopsis of what your overview of the course, the weekend, the whole pretty much experience, if you would, please, sir.
Okay. So started off with classroom stuff, going over the system, learning about the implants that we'd be placing, learning how to treatment plan a case. Super informative. And then went into the second day, started actually placing implants on live patients. And from somebody who's never placed implants before, myself, I felt it was a little bit out of my comfort zone, but we had instructors there showing us how to do it, talking us through it, and things turned out great. And we gained a lot of confidence and knowledge over the weekend.
So in the didactic portion, we covered anatomy, we covered physics, biology, we covered connections. I mean, do you think that was sufficient information?
Yeah, so it was enough, but it was not too much that we were actually able to retain what we were told. And I think that was pretty important. I don't know if we would have been able to cover any more information than what we did. It was a lot.
your brain was noodle by the time we left, right?
By the time you're done.
There you go.
Yeah.
So relative to the clinical courses that the clinical cases that you did, give me your experience. I mean, the first case you did, you're probably pretty nervous, cutting the flap and everything like that.
Sure. Well,
what's your thought?
Flapping was I do that pretty regularly. That was not a huge deal. So we did an immediate extraction and immediate placement.
Nice.
Or immediate placement of an implant. So that is probably more than what I want to dive into, going right back into my office. But it was good to see how that would work. So we did some cases that were maybe a little bit above what I would want to do straight Monday morning, but then I got to do cases that I would do next week if they were lined up. And seeing both sides of it, seeing more difficult cases and easier cases, it kind of lets you know where you are comfortable doing it by yourself. I thought that was pretty important.
Awesome.
Pretty good thing.
Any closing remarks, man?
It's a great class. I'd do it again.
Yeah? October? Anyway.
Yeah.
If you had one word, had summarized this course in one word, man, what do you think?
Ooh, thorough.
That's a good one. I like that, dude. All right, Doc. Thanks, man. Appreciate it.